This graph illustrates a dose-response curve comparing the effect of an agonist alone versus an agonist in the presence of a competitive antagonist. The y-axis represents the percent of maximum effect a drug can achieve. The x-axis represents the agonist dose. Key observations. 1. Black curve agonist alone shows the typical sigmoid shape of a dose-response curve. As the dose of the agonist increases, the response increases until it plateaus at 100%, maximum effect. The EC50, the dose needed to achieve 50% of the maximal effect, is lower here. 2. Pink curve, agonist plus competitive antagonist, shifted to the right compared to the black curve. This indicates decreased potency. A higher dose of agonist is needed to give the same effect. However, the maximum effect is still the same, meaning efficacy is not reduced. Conclusion: competitive antagonists bind reversibly to the active site of receptors. They increase the EC50, lower the potency of the agonist, without affecting the maximum efficacy. This shift can be overcome by increasing the dose of the agonist. USMLE Question 1. A pharmacologist is testing a new drug that acts as an antagonist to a known receptor. In dose-response studies, she observes that the presence of this antagonist causes a rightward shift in the agonist curve with no change in the maximal response. What is the most likely mechanism of action of the new drug? A. Non-competitive antagonism. B. Irreversible inhibition. C. Competitive antagonism. D. Partial agonism. E. Allosteric inhibition. Correct answer, C. Competitive antagonism. Explanation: the rightward shift without a change in maximum effect indicates competitive antagonism. This type of antagonist competes with the agonist for the same binding site, but can be overcome by increasing the agonist dose. Why not the others? A. Non-competitive antagonism decreases efficacy, not just potency. B. Irreversible inhibition cannot be overcome by increasing agonist dose. It would lower the maximum effect. D. Partial agonists produce submaximal responses, not shifts in full agonist curves. E. Allosteric inhibitors reduce efficacy and cannot be overcome by more agonist. USMLE Question 2. In a pharmacological study, drug A acts as an agonist to a certain receptor. When drug B is co-administered, a higher dose of drug A is needed to achieve the same response, but the maximum effect remains unchanged. Which of the following changes is most likely observed in the presence of drug B? A. Increased efficacy of drug A. B. Decreased efficacy of drug A. C. Increased potency of drug AD. Decreased potency of drug AE. Irreversible inhibition of drug A. Correct answer? D. Decreased potency of drug A. In competitive antagonism, the presence of the antagonist reduces the potency of the agonist, which means a higher dose is needed to reach the same effect. The efficacy, or the maximum possible response, is unchanged. Why not the others? A. Efficacy does not increase with an antagonist. B. Efficacy is unchanged, not decreased. C. Potency is decreased, not increased. E. Irreversible inhibition would reduce efficacy, not just shift the curve.